everyone. Welcome back to Let's Talk About It with Kelly. This is my husband, John. He is the trichologist at Freedom Clinic Toronto. And I'm Kelly. Welcome back. And this is season 2. So we're really excited to talk about all these exciting topics that we have. Eh, John?
Yep, let's go.
All right. So scarring alopecia is going to be the topic today. First question. For listeners who have never heard of this term before, what exactly is scarring alopecia?
So scarring alopecia is a type of hair loss where the immune system attacks the hair follicles, or sometimes the skin around the hair follicles, and destroys them. Now, there's other types of hair follicles that work a little differently, that involve maybe a neutrophilic infection, and that's a different sort of process of scarring. But the idea of scarring, what it means is that the follicles get destroyed and then the hair can't grow back. And it's usually a progressive thing. So it starts out small and then it spreads throughout the scalp. It may not go through the entire scalp. The important thing is that we try and stop this before it gets too far, because it can cause substantial hair loss. And any hair loss that it causes is usually permanent. With scarring,
it's permanent.
Usually with scarring alopecia, it's permanent.
Oh, wow.
There's no treatment to make it grow back.
This is the scary one.
Yeah. Yeah, it's scary for a lot of people, absolutely.
Yeah. Okay, how is scarring alopecia different from most common forms of hair loss, like male or female pattern hair loss?
So, as I mentioned, it's autoimmune mitigated. It destroys the hair follicle rather than slowly shrinking it, which is what happens in androgenetic hair loss.
Right.
It starts out a lot differently, although sometimes in early stages it can even mimic androgenetic. So if the scarring is a very small area and it starts in the crown, and a lot of scarring alopecias will start in this crown and just spread out. So when it first starts, you get a little bit of thinning in here, or the really tiny little spots. Some people can look at that and say, oh, it's just androgenetic alopecia, but when we do our analysis, we see that there are little patches of scarring in there. So the difference is that it usually creates little tiny patches of hair loss that expand. So eventually they can be big patches, but it creates a patchy hair loss, okay? It can easily be misdiagnosed as alopecia areata, which are those round patches that appear in various areas and sometimes get very large. Scarring alopecia can look a little bit like that. But the big difference, again, is the permanent nature of it. There are a lot of sensations that go along with it. Often you'll get this burning, itching feeling throughout the scalp, while it's happening or even before it starts. And that's the inflammation starting to set into the scalp. So it's a highly inflammatory type of hair loss. Inflammation's the main cause of this type of hair loss, yeah.
Wow, okay. Why is early diagnosis so critical in these cases?
So again, we want to stop it. We want to diagnose it early so we can treat it and stop it from progressing, because if we don't stop it from progressing, that hair loss is permanent, right? And then the person ends up wearing, having to get a hair system or wig. They're not the best, candidates for hair transplants, are generally not doable, some cases, but very rarely. You need to diagnose it earlier so we can stop it from spreading so it doesn't get too extensive.
Okay, thanks, John. What are the first symptoms patients should watch for to indicate scarring alopecia? You kind of mentioned a little bit about the burning sensation.
It's that tingling in the scalp, burning in the scalp, itchiness even. And sometimes, a person will get concurrent dandruff or even seborrheic dermatitis or even scalp psoriasis, and it can often look like that at first sometimes. It looks like flaky scalp psoriasis or dandruff. So if you're getting a little bit of dandruff and it's localized in the crown and you're feeling these weird tingly pain sensations in the scalp, then that could be an early sign of scarring alopecia. If you're getting little tiny pockets of hair loss, really small, like the size of a finger,
right,
and it's really localized and it's in one spot, that can be an areata spot. alopecia areata, but it could also be a scarring alopecia spot. So again, little tiny spots, we call it focal atrichia, where there's hair loss in a specific area. Then we want to, you want to get that checked out right away, and diagnosed microscopically, because by looking at it you can't tell if it's scarring, if it's areata, if it's even androgenetic alopecia. You can't tell just by looking at it.
This is why it's so important to see a trichologist versus an MD or even a dermatologist in some cases, because they don't have the time to do the microscopic analysis, and this is where mistakes happen.
Yeah.
Wow, that's kind of scary.
Yep, absolutely.
Okay, so are there warning signs that patients and healthcare providers often miss?
One of the things, would be the tingling or the pain in the scalp. A lot of people think that's in their head. They got this pain in the scalp. Oh, it's nothing. Or they're itchy, or they're got a bit of dandruff. Oh, it's nothing. It's just dandruff. So, these are things that people will present, and then they'll get sort of brushed off as not very important. Thinning in the crown is the hallmark of pattern hair loss in men. Not so much in women, and we see scarring alopecia. Well, we see it in men and women, but more often in women. So a woman comes and she's got a little bit of thinning in the crown, and then the person looks at it, androgenetic alopecia. Often it's not, and this is why it needs to be checked out thoroughly.
Wow. Okay, thanks, John. What actually causes the follicle to become permanently damaged in scarring alopecia?
So it's that action of the immune system, the inflammatory response of the immune system. It wraps around the hair follicle and it kills the stem cells in the follicle. Okay, the stem cells are what's responsible for rejuvenating the hair and keeping it growing throughout the anagen phase of the hair growth. So the hair is growing, and then it falls out. A follicle goes to sleep for a while. The stem cells then restart the growth phase. In scarring alopecia, those stem cells are destroyed. Okay, and of course eventually the follicle and parts of the follicle too. But because those stem cells are destroyed, the follicle can no longer rejuvenate itself. Okay,
thanks, John. What are the most common forms of scarring alopecia you see in your clinic?
So there's, I'd say, 3 very common ones. One of them is called frontal fibrosing alopecia. And this is a situation where the hairline starts to lose hair, it starts to go back. And the thing about it is it's not a standard recession in the temples. The whole front and often the temples will kind of recede at the same rate, going back, okay? And what happens is the skin will start to look a little thinner, paler. Sometimes there'll be little pimples or pustules on it. The hair will become very singular, meaning you won't see all those little fine, thin hairs on the front that you see in the edge of a receding hairline.
Right, the vellus hair?
Yes, you won't see those in frontal fibrosing. You'll see single strands, usually with a little bump near the root.
Okay. Yeah.
And those single strands are a real clear indicator. So the hair starts to go back like this. It often affects the eyebrows, okay, as well, or first. So sometimes we'll get eyebrow hair loss first, and then it'll extend into the thing. But it's called frontal fibrosing, and it's a recession of the hairline. Yeah.
Men or women?
Mostly women, but it can present in men, but it's mostly women. The second most common one is it's almost the same type of hair loss, only it's called Lichen Planopilaris, but it can affect anywhere on the scalp. So it usually starts in the crown and spreads out. The Lichen Planopilaris, okay? Whereas frontal fibrosing affects mainly
to
the
back.
front.
This is from the crown out.
The edges. So yes, Lichen Planopilaris, the crown out. It's a very similar mechanism, the autoimmune type of hair loss. So But with the frontal fibrosing, I should have mentioned also not only the frontal area, but it can affect around above the ears and even the bottom of the hairline at the back of the nape.
So all along.
All around these edges. But it usually starts in the front, and we call
Okay.
it frontal fibrosing.
Wow.
And the third most common type of scarring alopecia, again, very closely related to Lichen Planopilaris and frontal fibrosing, is something called, and it's a big word, Centrifugal Cicatricial Alopecia, or CCCA.
I'm not going to repeat that. I'm going to go CCA.
So this is something that mainly occurs. Well, the term is used to differentiate the type of scarring that happens in the African American population rather than Caucasian population. So it's a similar thing as Lichen Planopilaris, where you get small patches of hair loss starting in the crown and then spreading out. Okay, and diagnostically, treatment-wise, histologically, like it's very similar to Lichen Planopilaris. We just it behaves a little bit differently. There's a different area of inflammation in the follicles. There's certain slightly different characteristics, but it's basically the same thing as Lichen Planopilaris, but it looks a little differently in African American skin types. And often with that, for some reason, when we treat it, we sometimes get hair regrowth. And I guess it's just a slower process
So
of
it does
dying.
grow.
Well, in that case, before the follicles are completely destroyed, we sometimes get some miniaturization.
Okay.
Sometimes the follicles are just remaining dormant. So we treat it and we push the immune system away, and sometimes we get a little bit of regrowth. It's quite surprising. It does happen sometimes. But yeah, that's one of the other sort of individual characteristics about CCCA. But those are the three main types. So frontal fibrosing, Lichen Planopilaris, and CCCA. That's what we see the most of. But we do see a lot. We see cases of lupus that affect the scalp, start affecting the scalp. We see cases of Folliculitis Decalvans is quite frequent, and that's an infectious kind of scarring alopecia. And we'll see dissecting cellulitis, which is more complex type of scarring alopecia. There are a couple of others that we'll see rarely, but those are the main ones.
Okay, thanks, John. Are certain populations or demographics at higher risk for specific types of scarring alopecia?
Yeah,
For example,
so-
you mentioned African American.
Right, for the CCCA. It affects African American men and women, well, probably women a little bit more, but I see a lot of men with CCCA. With the other type, the Lichen Planopilaris and the frontal fibrosing. So the Lichen Planopilaris, more so in women, but common in men as well. Frontal fibrosing, more so in women. I don't think I've seen a man with an isolated case of frontal fibrosing alopecia in the 8 years that I've been really doing this.
Trichology.
These trichological assessments. I don't think I've seen a man with frontal fibrosing alopecia. So that's very rare. The scarring alopecias are usually in older populations, very often postmenopausal in women.
All right.
But I've seen frontal fibrosing in premenopausal women. I've seen Lichen Planopilaris in 30-year-old men, even or late 20s. So there are some demographics that do stand out, postmenopause, older populations, but they certainly can occur in just about anyone.
Okay, thanks, John. Have you treated patients who initially told you that they had standard hair loss when actually they had scarring alopecia? I think that's a yes.
Yeah, that happens
That's
all the time. It
right?
happens all the time. Most of the people I see with scarring alopecia have seen someone and been diagnosed with androgenetic
Genetic alopecia and it's scarring alopecia.
And often alopecia areata as well, because a lot of these scarrings can be patchy, right? So yes, I see that all the time.
Wow, okay. What is the most advanced case you've encountered, and what lessons did it teach you? Can you think of one?
Oh yeah. The most advanced case. It's quite obvious to me because it was a young male with Lichen Planopilaris. It affected almost his entire scalp. There was just little patches of hair loss left, hair growth left. But it started here, and it just rapidly progressed through his entire scalp. He tried every treatment. It just couldn't be stopped.
Wow.
Okay. Now, eventually it did stop. Scarring alopecia often burns out on its own and just stops happening. But this person probably lost about 80% of the hair on their scalp, and where they did have hair was just little patches. So what was amazing about this case was, we did some of the treatments, but what we did was we basically rebuilt his hair, and the way we did it, his hair and scalp, is first of all, and this was his treatment plan. It wasn't my treatment plan. He came up with this idea.
Okay.
So it's a male. Okay. The top of the scalp was pretty much completely gone of hair, and the sides had these patches of hair. So when it was shaved, you could see patches of stubble, right? So what we did was we filled in the sides and back with SMP.
Oh, so it looks like stubble.
So it looked like the whole thing was stubble. Okay?
Yeah.
And then we put a hair system on top.
Wow.
And then so he has this sort of, like a modern tapered cut, where you've got, the sides shaved right down and hair system on the top. And, I can't show you the picture of this, but it was amazing. And the most amazing...
Is he still a client?
Oh, yeah.
Or patient?
Yeah, we see him all the time. And the amazing thing is that it was his idea, not ours.
Well, it's good. Like, you're not closed off on just being exactly the way it's supposed to be,
Right. You have to think outside the box, and you have to let your patient participate in their treatment and their...
That's why you're such a good trichologist, John, I think, is because you listen to your patients.
Well, thank you.
Yes.
I try to.
You do listen.
I try.
You listen to me, too. Just kidding.
Happy wife, happy life.
That's right. Could damaged follicles ever recover once scarring has occurred? I think you kind of answered that.
Not usually. Like I said, sometimes in CCCA we might get a little bit of regrowth, and it could happen, but it's very rare for anything to regrow in scarring alopecia.
Okay. Well, the questions I have coming up, or I think you've already basically answered them. What treatment advances have given you the most hope in recent years?
For scarring alopecia?
Is there any studies out there that have new things coming out?
There's a lot of new things coming out, especially in the biologics. So
right,
all these biological medications. They're being studied all over for different types of illnesses and diseases. So this is the area where maybe they'll come up with something. Hopefully, I don't know of anything specific for scarring alopecia. There's a few that are specific for other types of autoimmune hair loss, like alopecia areata. But on scarring alopecia, I'm not aware too many that are coming on board right now, but that's certainly an area that I look forward to seeing, hopefully seeing more development.
What we should do, John, is we should gather some of these studies and maybe post them on our blog. That
sure,
people could look at that. Just have like a page with just studies if people want to look up and for themselves these new things coming out for studies.
Sure.
Okay, that's great, John. Thank you very much.
You're welcome.
And we'll talk later. Thanks, everybody.
Okay.
Okay, bye-bye.
Bye-bye.